harp too much on that topic, but I really want to dive into some questions I have for you, because I know that a lot of people have a lot of confusion these days, with skincare, with skin health, and like, things like acne, for example. I see so many posts on TikTok or Reddit where people are just genuinely confused about acne. And I want to ask you, like, what is the best way to approach acne, just from the beginning? Like, what are some steps that people can take to properly go about, getting help for it?
Yeah. Okay. So acne, basically people are confused about even what it is. So often people will diagnose themselves with acne when either maybe it is acne, but acne itself has different kinds of acne, like cystic acne. So you need maybe Accutane, or hormonal acne, and maybe you need to modify your hormones, or just good old regular adolescent genetic acne. And that's not that hard to get under control under the care of a dermatologist. So there's acne, and then there's rosacea, which can look like acne, but doesn't usually have the blackheads and the kind of zits. It's just more pink bumps. Yeah. And then you actually have eczema. So keratosis pilaris is like a bumpy, dry, kind of like hard, bumpy, dry stuff on the face. And the way to know if that's it is if your skin kind of feels dry, usually, if the backs of your arms are also kind of bumpy and dry, or even your thighs. So if you kind of know your skin and think like, what else do I have on my body? Do I get like ingrown hairs? Do I get folliculitis? That's more of an acne picture. Do I have like big cystic horrible things and I'm getting scarring? That's cystic acne. Does it only happen when I have my period, or for men when they're really stressed? That could be hormonal. Or do I also have dry skin elsewhere? And there's one other sneaky kind that's called pityrosporum folliculitis, where it's teeny micro pimples all over the face, like 1,000 tiny little micro pimples with a tiny little whitehead. And it's actually a form of yeast. And so that's not going to do well with the regular acne medicines. So I think that the reason everyone's confused is because it's a complicated pattern. And rather than buying charcoal and I have a patient today who was like, I put banana peels on my face. And I was like, that's a first. Like, apple cider vinegar. Somebody today was like, I'm drinking apple cider vinegar. I'm like, oh, how's that going for you? Like,
how's your GI lining doing?
Yeah, right. So they're like going to have other things. So I think some of the homemade brews are actually not that bad. The DIY acne stuff isn't that bad, but it's probably better to actually have a dermatologist look at it, because we're just sort of obsessed with these things. And then once you have a true diagnosis and have sort of the right way to start, the right strategy, then if you want to get creative with like sweet potato blends and a little bit of oatmeal,
like the mushroom that you find in like like ancient China, like the herbs. I hear you. No, that it makes total sense. And honestly, just to summarize what you said for everyone listening, it's like, first go to a medical professional to figure out what you actually have. Like, you might not know. If you think it's acne, that's fine, but it might not be,
Right.
So that's something that's like, I think, very, very important.
One point to follow with what you just said, once you do start treating your acne itself can change. And so like some people maybe they ordered Proactive and then it stopped working for them. That's actually sort of normal with acne. So things change a bit. And then that's also nice to have like a follow-up with your medical professional. And the worst thing people do, I don't know if you can read my mind, but what's the absolute worst thing people with acne can do to their face?
Dry it out too much.
Yeah, with like alcohol. Yeah,
yep.
Definitely that. And the other thing I was thinking of is picking their skin and picking their acne.
Yes. Yeah.
That becomes like an addiction. Like that little self-surgery, people love picking it. Actually, a lot of surgeons, plastic surgeons, come to me as patients and I'm like, how is it possible that you're picking your skin? Like, you should know. So if you ever are a skin picker, I would suggest buying like an aloe-based serum or something very gentle and using it on your skin instead of picking. And we have lots of tricks for that, but there are lots of ways to help people change their acne habits.